Welcome to our first episode of the podcast Mind Body. And today we have our first guest, Katya Zilberstein. She is a clinical psychologist, as she's a mind body therapist and somatic educator with PhD in psychology. Welcome.
Hi, Juyon. Thank you for having me.
So, Katya, I am very curious about this somatic practice of yours because I don't know much about it. Yet I'm a person who believes very much in mind-body connection. When I say mind-body, for me, it's emotion and spirit and our body. I believe that they're all connected. Could you tell me a little bit about yourself and maybe you can tell me about how you started your journey to become a therapist in this way?
Yes, thank you, Juyon. So I'm doing somatic practices for more than 10 years lately, and there was quite a shift in my profession. I came from psychology, which was more like scientific and educational field, like something from the books that you study. And then at some point, I had a kind of a crisis in life when I started to look for something new, a new modality. And then I came across the somatic practices. It was actually a book of Moshe Feldenkrais, Awareness Through Movement, and other books of the same period of time. It's like 60s, 70s of the 20th century, where there was a big wave of self-developmental and body awareness practices. And so looking for myself also for the healing, I realized that the connection between the mind and the body is much more than we think, than we used to think, and that there are a lot of practical applications from the going into the body and growing our awareness about ourselves, about our experience in sensations and in emotions.
Sounds interesting. You just mentioned your own personal crisis that actually brought you to all this. What was your personal crisis?
That was a story of loss. I used to have a partner that we were planning to be together and to get married. And then he suddenly passed away. And he was very young, like 39 years old, and nobody expected it. And he's very healthy. And he was an osteopath. And so being together with him for 2 years, I was watching and experiencing how he was working with people, treating people through very, very gentle touch. And that was amazing, but I never thought of learning it. And then when he passed away, it was like a gap. It was like I lost all the support system that I had before, and I had to find it new and build it up.
Wow,
So
I
I
can just
wanted,
imagine. I can
yeah,
just imagine your sadness and loss, when you're about to marry somebody, a partner, life partner, and then he suddenly passed away.
yes, and it was very unexpected and very fast. Like I didn't have time to prepare, and it was like you are, flying up, 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 and then suddenly you face the wall. It was such. Now I would call it a traumatic, which it was a traumatic experience. But that time I didn't know much about that. Um, so I went to study the somatics at that time of my life, and we
To
were
get
doing
better,
actually on the
in
yes, to
order for
help
you
myself,
to help
to help
yourself.
myself. Yes, and I didn't even know that by doing some movement practices, but in slow manner and in aware, being aware what I'm doing, that would allow me to process this grief.
So how did you arrive to that? Just by reading about Feldenkrais?
Yes, it started with the reading and not so much understanding what am I reading, what is it about. But there was
Yes.
something in that book they talked about, like try to feel the weight of the stone, let's say. And I was thinking,
Mm-hmm.
wow, really, the stone has a way to, this is something living life through the senses, or
Yes.
taste the food, or notice how you breathe. So while by reading and then starting to study it, I found out that there is a whole world inside me that wants
Mm-hmm.
to be explored by me.
Uh-huh. Wow, wonderful. It
And
must
yeah,
be such a revelation for you to realize that there's a whole lot of you that's inside that you can start looking into.
yes, and somehow it talked to me. It was very close to my soul, that to
Mm,
look inside and to explore. This is the direction I want to go, and this
I
is how
see.
I became a somatic educator, and I continue my journey.
I see. Did you have a, so I understand that you study psychology at the university back in Moscow. Is that correct?
Yes, that's right.
And then by the time you had this loss and you're grieving, and when you started to look into Feldenkrais, you were already a psychologist.
Yes, I was a psychologist in social psychology, but in a way, something was missing for me.
Mm-hmm.
The real, I don't know, the real experience, how people process their emotions, these crises like I faced, and also what is happening with the body. How
Mm-hmm.
can we approach through the body? In
Mm-hmm.
the psychology, in the mainstream, there is not so much about it. There was much more about the cognitive, things like some conceptual, some diving into like psychoanalysis, all these things. But there was not so much about here and now.
Yes. In other words, there are a lot of uh, understanding of why some things happened and what happened, and then what I'm feeling and thinking, but maybe perhaps no way to process it or to um, to release the pain or grief or anger, sadness, these things that
Yes,
reside inside of us.
yes, that's right. And there is the release part. I found it out on the way through the body. So that for me, this connection is the most interesting thing.
I see. So you started reading about Feldenkrais. At first, it was strange, and then you started to realize that it was interesting to uh, live life through senses, you said, right?
Yes,
Through the
that's right.
heaviness of the stone and how it feels to your hand, etc.
Yes, this is something that you start to feel that you are alive. How do you know that you are alive? Like you sense something, you feel it in the body. And then
Yes.
by going into the body and doing some movements also, then this comes a brain, how the brain works and how the nervous system works. So I started to study this, that there are like conscious part and subconscious part, and that they are connected, and through the body we can improve this connection between the
Mm-hmm.
thinking brain and the um, automatic nervous system. So
I
that was
understand.
the core of the healing.
I get it. Uh, while I understand the importance of making the body mind connection, I'm still very curious to understand how the modalities that you use can actually heal people or heal the trauma and release the emotions that are stuck inside of our body. Could you please explain to us some of the modalities that you're using and how they work?
Yeah. Um, so I'm using three approaches. All are somatic approaches. One is called Hana Somatic. Another approach is Feldenkrais method, and another approach is somatic experiencing. And each of them has its own tools to approach this body-mind connection and to their own way for healing and unique techniques. So there are many, but I'll try to describe few of them just as an example,
Okay,
some basic
sure.
things. So let's start with Hanna somatics. Thomas Hanna, he kind of invented the method of, he called it pendiculation. which is saying that everyone knows that when we're stressed, the body gets tense, right?
Yes.
And this tension, it has some patterns. It's like not only in one place. Let's say not only the shoulders are tense, but also the neck and also the belly and also the
Sometimes
inner
the
thighs.
head. Yes.
Sometimes here. So he said there are, let's say, two main patterns of the stress and the tension during the stress. One is red light, he called it, like when we do this, like everything is going inside,
Yes.
like in the
Contracting.
embryo, like contracting on the front. And the other pattern, it's also response to stress, but it's the opposite. It's contracting the back, expansion. It's also the
Okay.
stress pattern. And how to approach it. This is something that we are not aware of. Like we are doing it, but without awareness. Yes, we don't know that we are doing it. We only face the consequences of this. For example, if someone stays all the time with contracted here, this
Yes.
and the belly and the chest, then all the inner organs will be suppressed and the digestion will not be so good, and then he cannot breathe freely because the diaphragm is also contracted. So it might come to various symptoms and various disease, but the initial thing is that this basic contraction where someone got stuck and where is the way out? He cannot find the way out. So some somatics gives our tools how to approach this tension. So we're doing it actually if we think about the, let's say, belly muscles, we go into the contraction, we feel it, the person should feel it, he's active. He's a pupil in a way. He's not a patient, but he's a pupil. He's exploring himself.
Uh-huh.
So he feels this tension and he feels these muscles, and then he's slowly letting go. And then again, he goes into this contraction, and then again, he's slowly letting go. And by doing this process, he's connecting the brain muscle, brain body connection. And brain is realizing what is contracted muscle and what is released muscle. And then we go through the whole body. It's not only the belly, it's also the shoulders and the neck. And we're going in and then we're going out. And so this is the practice to release these muscles and to let yourself live free from stress, free from this chronic tension.
I
This is
understand.
how Hana Somatics approach this.
I see. So is it right that we have these kind of contraction movements, contracting inward, the front ones, and contracting in the back? So we do these things without realizing, yet it happens when we are under threat, or if we're traumatized, or if we're going through negative emotions. Then, and the practice of Hana Somatic actually helps you contract and release to send signals to the brain, so the brain understands that there's the contraction and there's the release, and reshuffles the understanding of the negative emotions or trauma. Is that correct?
It's not exactly. The Hana Somatics is not going into emotions. It's staying like with the body and with the body awareness and expanding it. And then the other approach, which is somatic experiencing,
yes,
it is already going to the emotion. And this is when I started myself to study somatic experiencing recently, 2 years ago when I came to Israel. And again, it was a personal story because I felt like I was overwhelmed with everything that happened in my life. And that somatics that I knew was not enough for me. That I had an emotional, something like depression, like starting of the depression. And I realized that is really traumatic what I'm going through. And I started to look, how can I help myself? And I found this somatic experiencing, and it's approaching a trauma,
I understand.
stress and trauma and emotions that you are saying. Also, by processing it through the body. And I can talk a little bit more about it, about
Yes,
what are
I'd love
the
to hear about
tools.
it. Yes, but before you continue, I just wanted to ask you uh, uh, about what you're going through briefly, if you don't mind. I understand that you moved to Israel 2 years ago during the war of Ukraine and Russia, right?
Yes,
And then and then soon after that, Israel started. Israel was in a war of its own.
yes, exactly. This
So
is
you moved
what
from one
happened.
country to another as an adult because
Yes,
you moved away from the conflict, and then you ended up in a new conflict
yes, exactly.
with a new language, new environment, new friends, new colleagues. And
Yes,
so big changes.
big changes, very big. Yes,
Yes.
it was very difficult, really, and still is, and still in the process. And I think everyone who changed the country, or everyone who were in the war, when the country is in war, they know how difficult it is. But
Yes.
then it's also important to understand that trauma is not the event itself, but it is the reaction of the person to this event. So we all are different. We are very different.
Wow.
And
Wait a second. What you just
mhm.
said is really important, I think. Trauma is not what happened to the in the war. It's what did you say? It's the reaction to what happens to the people.
Yes, it's individual reaction on what has happened.
Yes.
And I guess for me, it was too much. Like if there would be only, let's say, I would only move the country where they can cope with it. Or if there would be, let's say, one war and
Mm-hmm.
not the other one again, I could cope with it. But that was like too much for me and too fast.
Yes. Yes. I understand. As I'm also like as I live in Israel, I know that there's a lot of trauma in Israel, even among the people who live here. You and I are not the ones who are directly affected because there are people obviously who are affected in the Nova Festival who are kidnapped and the direct
Yeah.
families of these people.
Hmm.
Yet every single person who lives in Israel, we feel the war.
Yeah. Everyone feels
Yes,
it. It's
yes,
like it's impossible to live somewhere and don't be influenced by it, don't feel it.
yes,
And in Israel now, it's really, just today I heard that there are 3 million people who are traumatized and emotionally, and they don't have help because there are not
yes.
enough health practitioners to support those people.
I understand. I understand. Uh, Hopefully I actually it was going to be a surprise at the end, but I want to say that at the end of our talk I actually Katya suggested that she was going to uh, showcase to us and have us follow some of the healing uh, healing tool, so we can practice it. We have this coming up at the end of the talk,
Yeah.
so please stay tuned. And going back to our original flow, so you told us about the Hana Somatic, and now you're about to explain a little bit about the somatic experience. How does that go?
Yeah. Just before I go to somatic experience, I also wanted to mention the Feldenkrais method because it's
Aha.
really something I very much respect and love, and it deserves to be known and heard
Yes. Yes.
about the method. So Moshe Feldenkrais, he was an Israeli physics, and he was also doing judo, uh, and he made his method of initially he called it improving abilities. So his
Okay.
idea was that we can improve anything, like anything we do, we can do it better. And his aim was to teach people to learn, how
Mm-hmm.
to learn. And he did it through the body and through the movement. And he developed
Mm-hmm.
many lessons that he called awareness through movement. It's doing in a group format, done as a lesson for a group of people. And there is also individual treatment, which is called functional integration. which is working with the body through the touch to help the integration to become. Okay, in a way, when we're talking about healing, we're talking about integrity, like becoming whole, right? I don't know how it is in your language. In Russian, there is the word исцеление и целый. So the root of the word whole is the same that healing.
Oh, wow. So I love that. It's very
Yes,
interesting.
I also
To be
love that.
whole, to be
Yes,
whole
to be
is to be
whole, where
healed.
everything is connected, like you are one, like
Wow.
there is no conflict.
It makes a
And
lot
in
of
a
sense
way,
to
like
me.
if we talk about the body and we start to work with someone, we see how many conflicts are there. Like this is not moving, for example. This is moving too much. Like let's say the neck is moving too much, and usually the lower back also are moving too much. The thoracic part of the spine is moving too little. So then another parts that are moving too much, they need to do a work for two, and then they get tired, and then we feel pain. And then when we can bring more movement to the thoracic part that is moving less, then it's helping the neck and the lower back to reduce the load. So it's like in one system, one big system. And through doing the functional integration, we are helping all body to become one. When they, let's say, big and heavy muscles, they would do heavy work, and small muscles would do precise work, just as it was designed, so to say,
Mm.
by nature. So this is what we are helping. And what we're dealing in the Feldenkrais method, usually in the individual sessions, we often deal with, again, post-trauma, when the trauma physical trauma, let's say like the shoulder was injured, or there is a scoliosis or things like that, pain
Mm-hmm.
and the restriction of the movement. We're also dealing with neurological things like after stroke or a cerebral palsy, or any neurological issues also can be addressed, because this is again bringing the awareness of the brain. Brain starts to realize that he has this body and how to control it.
Mm-hmm. But how does
Yes.
that connect to our psychology?
Uh-huh. Good question. A really very good question. Because Feldenkrais himself, he didn't thought about himself as about psychologist. He didn't think that Feldenkrais method is a part of the psychology. But body mind psychologists, they include Feldenkrais method as one of their techniques. I would say the Feldenkrais is teaching us to be free in the body and in the mind, to see
Mm-hmm.
the variety. It's to study it's a new approach actually to the experience that we are living. It does
Mm-hmm.
not talk about emotion like at
Mm-hmm.
all. And
But
I think that it has a reason. I think the Feldenkrais himself, and at that time they were very much traumatized themselves. They had
mm,
very difficult history that
yes.
happened. Like let's say the Feldenkrais, he was born in Russian Empire at that time, and when he was 14 years old, he went by foot to Palestine, which is now Israel.
Wow.
By foot, a boy, a child actually, 14 years old. And there was a
Wow.
lot of anti-Semitism, and it was many dramatic things that happened. And then there was World War II, where he also participated. And so there were so many things. And also at that time, there was not this awareness around trauma that we have now. So they were not talking about emotions, and they didn't touch it. And this is
Mm-hmm.
how it was. And this is, I felt lack of, like I was looking for, okay, but we are working with a person and there are feelings. How can we address the feelings? And this is how I came to somatic experiencing by Peter Levy.
Okay. Okay. So I'm very excited. Tell us about the somatic experience.
Yes, and so here the somatic experiencing is addressing the issue of trauma and how people get traumatized. And I think everybody already know that the classical symptoms of trauma are like flashbacks, when someone is like waking up at night and seeing something that has happened during the war, during the accident, some very strong emotions and situations. So actually, it's even more wide. We can call a trauma anything that still stays in the nervous system, that is still present. Like, for example, what many people now in Israel experience is that when there is this alarm about the
Yes,
rocket fire, like very
yes.
many people can get even
Triggered.
anxiety attacks. Yes,
Yes.
so some strong, some a little bit, um, because they already had like the history that it's dangerous. So anything that our brain, our nervous system considers as a danger for life, it goes into this what we call a trauma vortex. It's
Trauma.
like a vortex,
Vortex.
vortex,
Uh-huh.
vortex. Yes,
Yes.
vortex, because it's like, wow, you're strong, you're going there, it's
Mm,
taking you there, and you completely like lose your awareness again.
yes.
So the trauma is the event in the nervous system of a person. When the
Yes.
thinking brain, the neocortex stops working, and the emotional brain and amygdala starts working. And it works very simple. It's fight or flight or freeze.
Mm-hmm.
Like there are these three modalities that the emotional brain has to help us to survive. So rather we need to run away very fast, or we will fight, or we will just be frozen.
Mm, I see. And somatic experience. Okay, so I understand Feldenkrais is invented by Feldenkrais, right? And at first, while he called it in the beginning, how, you called it
Improving
improvement,
abilities.
improving
Improving
abilities,
abilities. Yes.
later called Feldenkrais method. And Hannah Somatic, I understand, is invented by someone whose name is Thomas Hanna.
Thomas Hanna. Yes.
And what about somatic experience? Who invented it and how did it come about?
Yes. The somatic experiencing was invented by Peter Levine,
Mm-hmm.
and he was working with the people who were traumatized, and it's very tricky, like to work with these people. Like there are symptoms, but you really don't know what to do with it. So there was one
Yes.
situation with one of his clients when he intuitively started to scream, like he screamed, "Run! There is a tiger in the room!" Like suddenly from nowhere, and the woman like stood up and started to as if run away. And then he, by this case, he realized that trauma is not completed movement in the body. That something arise, all this energy went up to make a movement, and then it was impossible to make a certain movement. So
Mm-hmm.
this energy stayed in the body, stayed stuck in the body.
Yes.
So how we work in the somatic experiencing is that we very gently and very slowly we approach this energy, the traumatic energy, which we can see by the symptoms, like let's say the feeling of the tightness in the throat, for example,
Yes.
or in the belly very often. Yes, or very often it's like a heartbeat, speed
Mm-hmm.
heartbeat. So we divide this big strong wave into one small pieces, and then a small piece our nervous system it can digest it. So we ask someone to be aware of the sensation and stay with it and wait and see what comes up next. And most of the cases this sensation just is just disappearing, and we're
Mm-hmm.
calling it a discharge. So
Uh-huh.
it means that it's just gone, it was processed, because we have this trauma vortex, and at the same time, we always have a healing vortex. We
Mm-hmm.
want to be healed, and the nervous system has all the capacities to do it. We just need to
Yes.
help.
Yes. So usually when we're in a trauma, we either fight or we run away or we freeze. But instead, when we catch ourselves for example, using tools like somatic experience, we can catch ourselves in the somatic, in the trauma vortex, and then we allow what the emotion was that trapped in the trauma, and then we let it exist and process, and then it discharges.
Yes, we are discharging the sensations in the body, and we become aware of the emotions that are there inside. And usually there are layers, not
Yes.
only one. There are many, and we need to process all of them, give them time and space, and process them through the body again. And then we are
Yes.
also coming to the meaning part, which is also very, very important. Like, what the person thinks actually, and what is the solutions, and what decisions he has made after going through this experience. And so we're working on all these layers: sensations, emotions, thoughts, and values.
And the future planning so
Yes,
that
and also the future planning and
I
the
understand.
behavior.
Mm-hmm. I
Everything is
wanted to
changing.
know, so often in my clinic, in my acupuncture clinic, I have clients who come to me and let's say, I guess trauma is a broad term. So there are people with different kinds of different levels of trauma. And sometimes people come to me and they suffer from anxiety, and then they say that they love
Mm-hmm.
doing intense exercises because it releases them.
Uh-huh.
But then they keep
Uh-huh.
coming back, right? So do you
Mm-hmm.
see that when someone uses the tool like somatic experience and allow for the emotions that there may be triggers for anxiety to exist and process, then actually, in fact, this person can be free of anxiety?
Uh, yes, when we go through the process of the treatment successfully, then the result will be that there will be no more this stuck energy in the system, and so the anxiety will go away because it's a symptom. This is something that is on the surface, a symptom. And then we can see it if the healing has happened, then the person is neutral about what has happened to him. For example, I gave my personal example of the loss, yes, that I experienced, and now I
Yes.
can speak about it. Like, this is the part of my life. I own it. It happened to me. It meant a lot to me. It gave a lot to me. I have a lot of gratitude to what has happened, and I can continue. Like, I'm
Mm-hmm.
in a new relationships now, and it's not stopping me. With traumatized people, they are like in the trap. They're there, even if it happened 30 years ago. They still live that
Mm-hmm.
situation. And if someone is healed, we know it by this feeling of the gratitude, by the new, or being neutral about what has happened, accepting it, and moving forward in life.
Wow, that sounds very hopeful. Now, there are people who have trauma, but then there are people who are, somebody might say, hey, the thing is, I'm not traumatized, but I'm actually, very having difficult times day to day because things like taking an exam gives me
Mhm.
anxiety, or preparing for a presentation at work gives me anxiety, and I'm losing sleep over it, or I'm breaking down thinking about it, or somebody might be like, when I visit home to see my mom, I feel
Mhm.
like, I'm always
Yeah.
triggered, with things
Yes.
like somatic experience or Hana somatic also benefit a person like this.
In these cases, yes, actually, for in our understanding, it is a trauma. Like, trauma is
Mm-hmm.
not that something so horrible has happened, but something has happened, and it continues to be, and it influences the functioning. Like it's okay to worry before the exam. Like everyone worries, that's fine. But if it's so unbearable, like so like someone can sleep the whole week, let's say, it says yes, there is a traumatizing. And the same with your
Mm-hmm.
example with the relationship. Like if every time I talk to my mom and I finish like I don't know crying or keep thinking about it for a month, it means there was a traumatization.
I
People just
understand.
don't know. Also, when I started to study this topic, I was so surprised. I didn't know that there are so many small things that are making me activated. We call it activated. Like
Yes.
for example, the when I see the ambulance, and I'm kind of thinking maybe the ambulance is going to my house because I have an elderly mother who is sick, and I
Mm,
saw it. And after that, she was in the hospital, and now every ambulance is triggering this. This is the trauma.
I
So this
understand.
is the good thing that we can discharge it. And then I see the same ambulance, but I'm neutral. I'm not thinking that it's for me.
Yes, I understand. Wow, I think you do a very meaningful work. I think a lot of people in Israel need this kind of work. Do you, as a practitioner, have any challenges in your practice, in your clinical work?
Yes, of course. I think everyone has. I have a lot, a lot of challenges. So when it's coming to the real life and real clients, I see that many times it's a long road. It's not
Mm-hmm.
something chick chack. It can be chick chack if a person is, let's say, very healthy, young, and something has happened one event, and it has happened recently, maybe 1 year ago, and then sometimes we can work with this even few sessions, and then he's done, and everything is
Mm-hmm.
the symptoms are gone. But most of the time, when people come to me, and there are so many layers of what has happened to him
Yes,
that we start to work and then it's new things and new things and new things and it's a longer road and
I see.
it it takes a lot of time. And
Yes.
also sometimes also I face that when there is just when someone needs medication, also when it's not enough, it's just we work but the symptoms it's not helping, or someone is really so his nervous system is so much dysregulated that those practices that I can propose, that I can give, they
Mm-hmm.
are just not enough, and there is need to go to a psychiatrist and take medication. Sometimes it's needed.
I understand. Why I, as an acupuncturist who practices also, with people with emotional challenges, I cannot agree more. These are the challenges I face as well. Well, Katya, thank you so much for all your talk and information. And now, finally, comes the time that you can showcase us some of the techniques that you have, so that we
Uh-huh.
can end today's talk with some discharge.
Okay. Okay, let's do some practice, and I invite you to sit comfortably. Be
Yes,
sure that you have a support under your feet. To put your feet on the floor
yes.
and feel the support of your chair and maybe for your hands, and really find the good place. And also, I'm inviting our audience who will listen to this podcast to find a good place for yourself and close your eyes and notice how you are sitting. And notice your body. Just put the attention inward and start by noticing the support of the floor that you have under your feet and under your thighs, and really feel the weight of your legs, and sense how your back is supported by the chair and hands. have support, and sense that your hands also have weight, and find your head, sense that it's also heavy, how the head is positioned on the spine, and turn into the most firm part of your body, which is your skeleton and your bones. And try to imagine that if you would be an X-ray, if you have an X-ray vision, try to turn into the sensation of your bone. Sense your spine all along from the place where your head, your skull, is connected with the first vertebra and moving down along your spine, sensing every vertebra on the way down towards the sacrum and coccyx. And then notice your pelvis, bones, big bones of your pelvis, sitting bones, and feel how you are sitting on your sitting bones while sensing your pelvis and your spine. Just let go of any effort that there is in your muscle. You don't need to hold yourself. You have the support from your bones. Also notice your rib cage, 12 ribs that are connected with the thoracic spine. Notice the shape of your rib cage. And notice again your spine. And then there is the skull on the top and the rib cage in the middle. And the pelvis is the base of your skeleton. And then there are bones of your lower limbs, thighs, lower legs, and feet, many small bones of your feet. And then notice also your upper limbs, which are your clavicles and scapulars, and the bones of your arms, and finally the bones of your hands. And now feel the whole skeleton that is supporting you. Let go of any muscular tension that you notice. And notice, see what it gives you when you turn into your sense of your bones that are connected with the earth and with the gravity. Through sensing your bones, you can build an inner connection with the whole planet Earth that is holding us and giving life. And now soon we will be finishing this practice. And before you open your eyes, please find the movement of the breath, how you inhale, how you exhale. And with the next inhale, you can slowly open your eyes. Slowly, slowly come back to where you are and what is around you. And this was our practice.
Wow. Katya, thank you so much. I feel so refreshed.
Wow. Yes, wonderful. This
Yes.
is the somatic practices. They are giving this liveliness feeling, giving
Yes.
energy, also new perspective of wow, we always have the skeleton. We don't need anything else. Like we just need to connect and build this certain mindset.
Yes. Okay. Thank you so much for today. And I am going to leave Katya's number for anybody who has any further questions, or if you would like to book an appointment with Katya to release some of your trauma, if you have anything that you would like to work on. Information will be included below. Thank you so much, Katya. Until
Thank you,
next time,
Joan. Thank you very much. Thank you everyone for listening. And see you. See you next time.
see you.
Bye bye.